Panitumumab folfox4 treatment and RAS mutations in colorectal cancer. Definition: patients with metastatic colorectal cancer that harbors RAS mutations in exon 2 do not benefit from anti-epidermal growth factor receptor therapy. Other activated RAS mutations may also be negative predictive biomarkers for anti-EGFR therapy. Background: in this prospective retrospective analysis, we assess the efficacy and safety of panitumumab plus oxaliplatin and leucovorin folfox4 as compared with folfox4 alone according to RAF or BRAF mutation status.
The large intestine, or colon, is a part of the gastrointestinal tract that makes and stores stool. It includes the ascending colon, transverse colon, descending colon, and the sigmoid colon. The cause of cancer is an uncontrolled multiplication of cells lining the colon. Before a true cancer develops, it usually begins as a non-cancerous growth called a polyp. Certain people can have multiple polyps in their colon, which are inherited genetically. Over a period of several years, a polyp has the potential to become cancerous. A
Clinical data have also implicated RAS genes as negative predictive biomarkers. Most patients with metastatic colorectal cancer tumors harboring a mutation in RAS or NRAS did not have a response to anti-EGFR therapy.
Open colon surgery is the traditional method used by most surgeons to remove a segment of colon. This technique requires a large midline incision and is an invasive procedure resulting in a large scar. Open retractors are used to expose the abdominal contents with the small bowel and colon seen here. In this case, a colon mass of the sigmoid colon is identified and isolated for removal.
Previous studies of anti-EGFR therapies combined with oxaliplatin-containing regimens have shown negative outcomes in subgroups of patients with KRAS mutations in exon 2. Application in medicine. Adjuvant treatment in patients with stage 3 colon cancer is recommended for 12 cycles every 2 weeks. Activating mutations in RAS, KRAS, or NRAS, in addition to KRAS mutations in exon 2, have been suggested as negative predictive biomarkers for anti-EGFR therapy. KRAS mutation is an established predictive biomarker of resistance to anti-epidermal growth factor receptor therapy in patients with metastatic colorectal cancer. Pros and cons. Pros. In patients who had metastatic colorectal cancer without RAS mutations, improvements in overall survival were observed with panitumumab folfox4 therapy.
Rectal cancer is a specific cancer diagnosis that is located in the very end of the colon, or what's considered the rectum. It grows on the inside of the lining and it can invade through the wall or grows through the wall of the rectum and into other adjacent organs or into the lymph nodes around it. Unfortunately, the most common symptom when patients develop symptoms from colon or rectal cancer, they'll develop bleeding, they can develop pain, they can develop diarrhea or change in bowel function, and they can develop weight loss.
Cons. Additional RAS mutations predict a lack of response in patients who receive panitumumab folfox4.
The symptoms of colorectal cancer can be things like bleeding or constipation, a change in the way the bowel movements work. But sometimes, and in most cases, there are no symptoms at all before someone is discovered to have colorectal cancer. That's why it's so important to anticipate that and do colonoscopy starting about age 50 in most people, and to go look for the polyps and see if there's going to be any problem developing.
Issue apply in Ecuador. The primary objective of the current prospective retrospective analysis was to evaluate the treatment effect of panitumumab folfox4 as compared with folfox4 alone in patients with a RAS mutation in the primary analysis population of the PRIME study.